So let's talk about something a lot of guys are going through right now. You're on one of these new weight loss drugs, maybe Ozempic, maybe Mounjaro, and the numbers on the scale are finally going down. But here's the thing. You feel, well, you feel worse. We're going to break down exactly what's happening inside your body and why. This is the big question, right? It's a total paradox. You're doing what you're supposed to do, the scale is moving, but instead of feeling great, you feel just completely wiped out, drained. If that sounds like you, listen up, because you are definitely not alone in this. I mean, just think about this guy for a second. A high achiever, an executive, he loses 34 pounds, which should be a huge win. But instead, his life is falling apart. By lunchtime, he's totally exhausted. He can't focus on big decisions. His drive is just gone. This isn't some rare side effect. It's a pattern that doctors are seeing again and again. Okay, so let's get into what's really going on behind the scenes here. These medications are incredibly powerful, no doubt about it. But they come with a hidden cost, a serious trade-off that, honestly, most doctors don't even talk about or might not fully understand themselves. And here it is. This is the heart of the problem. When you drop weight this fast, your body isn't just burning fat. The clinical data is clear on this. Somewhere between 25 and a shocking 40% of the weight you lose is your lean muscle, your strength. So let's say you lose 30 pounds. That could mean 12 pounds of muscle, just vanished. We actually have a name for this. It's called the semaglutide muscle crash. And it's not just about losing muscle. It's a full-blown hormonal collapse. That huge calorie deficit is like a panic button for your body. It thinks you're starving, so it shuts down the most important system for male vitality, testosterone production. And these are the classic signs. I want you to ask yourself if any of this feels familiar. Waking up already tired, a sex drive that's just completely off the charts low, fumbling through decisions that used to be easy, feeling irritable, or just not like yourself. It's not in your head. This is physiology. This is what's happening. So you've probably mentioned this to your doctor, right? And you probably got some advice that felt, well, a little too simple, and frankly, pretty frustrating. Let's talk about why that common advice almost always falls flat. This is where it gets maddening. You're told, oh, it's just a normal adjustment. No, it feels like your entire endocrine system is hitting a wall. They say, just eat more protein. But you can't fix a broken engine by just pouring more gas in it. And the worst one, just give it time. That might be the most dangerous advice of all, because you could actually be making yourself biologically older faster. This analogy just nails it. Think about it. Protein is the pile of bricks and lumber at a construction site, but testosterone is the foreman. He's the one with the blueprint, telling the crew what to build and where to put it. If the foreman walks off the job, you can have a mountain of bricks and nothing gets built. You can't rebuild muscle if the hormonal signal to do it is gone. All right, so we've spent enough time on the problem. We get it. It's real and it's serious. So what's the actual clinical solution? Well, it's a very specific strategy called the dual optimization protocol. And the whole point is to fix the root cause, not just chase the symptoms. So how does this actually work? It's pretty smart. First, a precision-dosed testosterone replacement therapy, or TRT, is added to your program. This new testosterone signal basically overrides that starvation mode panic signal. It tells your body, hey, we're not starving. We are strong. Protect the muscle. And once that happens, the GLP-1 drug can do what it does best, burn fat, specifically the most dangerous kind of fat, that visceral fat around your organs. And the big question is always, okay, that sounds great, but how long until I actually feel better? And there's a pretty clear roadmap here. In just the first 2 to 4 weeks, your energy starts to come back, sleep gets better. By the second month, that brain fog starts to clear out. And by 4 to 6 months, you're looking at achieving your weight goals without having to sacrifice the man you are to get there. Now, I have to be really clear about this. Not all treatment is created equal. There's a world of difference between some generic cookie-cutter approach and a truly precise medical standard of care. You need to know that difference. So on one side, you've got a lot of clinics that use a one-size-fits-all plan for everyone. But a precision approach, the right approach, is all about microdosing that's tailored to you, based on really comprehensive blood work and constant monitoring. This is how you avoid side effects and make sure the therapy is working perfectly for your body. You know, an approach like this has to be backed by serious experience. You want to look for a physician with decades in the trenches, someone with a deep, fundamental understanding of how all these hormones work together. This isn't about chasing a trend. It's about expert medicine. A track record of treating thousands and thousands of patients says a lot. It tells you that a provider knows how to look at the whole picture, to find the root cause of why you feel the way you do, not just put a Band-Aid on one symptom. And let me tell you, this part is non-negotiable: safety and quality. You absolutely have to know where your medication is coming from. Any provider you even consider should only be using FDA-registered 503B compounding pharmacies. It's the only way you can be 100% sure you're getting the highest standards of sterility, potency, and purity. Period. Okay, so we've laid it all out: the problem, why the common advice doesn't work, and what the real clinical solution looks like. So now, let's talk about you and your personal path back to feeling right. Just run through this list in your head. Are you on these meds and feel foggy and wiped out? Did you lose the weight, but now you just look kind of soft? Has your edge, your resilience, just disappeared? And maybe most importantly, have you tried to talk about this, only to have your concerns brushed aside? If you're nodding your head yes, it's probably time to get a real evaluation from someone who gets it. And this is really the whole point, summed up perfectly by Dr. Kumar. You shouldn't have to make that choice. The goal isn't just a number on a scale. The goal is to lose the weight while feeling more powerful, more focused, and more alive than you did before. That's a real transformation. So that's what it all comes down to. It's time to stop sacrificing the very thing that makes you strong. You've earned this weight loss. Now you deserve to keep your strength and reclaim the energy and the drive that makes you, you. If you're ready to get off this roller coaster and start feeling right again, the very first step is a full evaluation of your hormones and your metabolism to see what's really going on under the hood. You can give the team at LifeWell MD a call directly at this number. You can also find a ton of information and schedule everything right online at LifeWellMD.com. Thanks so much for tuning in.